Welcome back to Lookuptv. You are watching The Morning Drift. My name is Simba Elijah Charles here again. Let me get into that big conversation today. And we did ask, is Kenya winning the fight against the cancer? So you have to know that in terms of cancer, it is the third leading cause of death in Kenya and the second leading cause of non-communicable diseases, that is the NCDs, after cardiovascular diseases. Now, if you look at the annual incidences of cancer mortality cases, you will see that we increased from 47,887 cases in 2018 and 42,116 in 2020. However, the annual mortality that was reported as dropping slightly from 32,987 in 2018 to 27,092 in 2020. So you can actually look at that. I mean, when we go back 2 years ago, when this report really focuses on, we'll see that it is huge numbers that we're talking about here in terms of the incidences of cancer in the country, going all the way to around 42,000 in 2020, and the numbers now, mortality cases, 27,000 to be exact. That is a big number. Now, to help us answer that question today, we are joined by Dr. Catherine NALIAKA, who is a HOD cancer treatment at the Kenyatta National Hospital. Dr. NALIAKA, how are you doing?
I'm good, and you?
Fantastic.
Yeah, thanks for having me.
Anytime. So, anytime we have conversations around cancer and cancer treatment and advancements in the country, for quite a long time, it has looked like a gray area, but you would say that we're making strides in the right direction. I want you to give us the state of our fight against cancer first from KNH, and then if you can then help us paint a national picture of exactly where we are in terms of our cancer fight, especially in 2023 now.
Yeah. So as Kenyatta National Hospital, we're really focusing on improving the quality of care for cancer patients, and there are various strides that have been made over years. Our cancer center is actually one of the oldest cancer centers in Kenya. We are over 50 years in the service and the fight against cancer. We have a lot of partners that we are working with to make this reality come true. One of it that has been a turning point is what we call the Patient Navigation Program, where we had the American Cancer Society supporting this initiative because we did what is called a patient need analysis.
Yes.
That was back in 2015, and we noted certain barriers that patients were facing in accessing timely cancer care. In fact, over 30% of the patients either had missed or delayed their treatment. And we asked, what is the problem? Why are you not getting timely care? So one of the barriers was physical, like just trying to navigate Kenyatta. When you arrive at casualty and you're told you need cancer care, it was a problem. They didn't know where to go. Another barrier they found was financial. People don't have money to go to hospital. And then we had accommodation. Patients didn't know where if you don't have a relative in Nairobi, you could they could sleep in casualty, like on the corridors. So identifying those kind of barriers through patient navigation, we put a strategy on how do we overcome this. So one was about the physical, patients were getting lost along the way. So through patient navigation program, there are footmarks put. So when you walk into Kenyatta, wherever you see a footmark, you follow that, it will take you to the cancer center. Yes, and then we also have putting up what is called a hope hostel to take care of these accommodation issues that patients were sleeping in casualty. So there are funds, Welishas have put together funds that we hope come towards the end of this year, there will be groundbreaking to build what is called the Hope Hostel. So a cancer patient coming to Kenyatta will have a place to sleep, to eat without paying anything, and then now access the cancer treatment.
Yes.
The other barrier was financial. So how have we overcome this? By encouraging our patients, educating them the importance of getting an NHIF card. If it is a married person, we encourage that your spouse gets another card for you, puts you on his card, and you also get one and put him on yours. So with that, you are able to get chemotherapy, radiotherapy fully covered by NHIF. And then there was also a barrier whereby people were not aware. You know, awareness is it's a problem. So you need to be aware about your diagnosis, your treatment, what are the complications, what are the expectations.
Yes.
So with that, we have what this has really changed the way cancer patients get care at Kenyatta National Hospital.
Yes.
Other things that as a hospital has done is the expansion of the infrastructure to take care of this increasing number of patients. So for example, we are building a cancer center of excellence, which was phase 1 is actually almost complete and will be moving in soon. And we hope to build up to a 10-story building just purely for cancer patients. We're also building what we call bunkers. These are rooms to house new state-of-art cancer equipments. And soon, actually, the contractor is on ground and the construction is going. So there are a lot of things that are happening. As a hospital also, we've partnered with the University of Nairobi and training oncology doctors. They are training nurses, oncology nurses, radiotherapists,
Yes.
medical physicists, radiation oncology doctors, medical oncology doctors. And then also as a unit, we've expanded to streamline what is called specialized health teams. So if you are a child, there's a team you'll go to. If you are you have maybe throat cancer, there is a team that you will join so that they are really focusing on treating that kind of cancer. So there's a lot that is happening. And then as a hospital, we have other disciplines. We have surgical disciplines, which are quite strong. The medical disciplines are very strong. Pediatric oncology, very strong in the spirit of multidisciplinary care. We also have meetings, what we call tumor boards, whereby we discuss our patients and give them the best possible care. Now, when you go to the national scene,
Yes.
as KNH, we build capacity in the counties. So we've been supporting Nakuru. There's now the cancer center in Nakuru PGH. We supported Mombasa. So there's Mombasa Cancer Center in the county referral hospital. We've also been very instrumental in supporting Kenyatta University Teaching and Referral Hospital, and it has grown to be a very strong hospital in offering cancer services in Kenya. We have Eldoret, Moi Teaching Referral Hospital with cancer equipment, and going now to the north, we are at Garissa.
Yes.
Yeah, it also has a cancer center. And then there are other, what we call chemotherapy administration centers in the country, about 10 of them. And this is all due to capacity building through KNH as a national teaching and referral hospital to try and support those spokes in the counties to ensure that the cancer services are even taken back to the Wanjiko in the village, because as I mentioned earlier, we noted that patients had a lot of physical barriers in accessing Kenyatta.
Yes.
And one of the physical barriers is just transportation. How do they get to Nairobi? So if we have those centers there, you find that the access is even much more better. And then as a country also we have the National Cancer Institute, which is also looking at strategy on how best to improve the cancer services nationally. We have the National Cancer Control Program through Ministry of Health, also embarking on a different angle, but just as an effort together to improve the services. We have National Cancer Treatment Guidelines. Currently, we are working on what we call radiotherapy protocols for the country to ensure that if you are getting radiotherapy in Mombasa, it is just as good as if you are in Nairobi and you don't have to come to Nairobi.
All the way to Nairobi.
Then as a country also, we are looking at encouraging awareness in the counties and pushing the county governments to have these cancer screening services free in the counties.
Yes.
So, and also through UHC, through NHIF, a lot is really happening.
Pretty much. Want to go back to this report, by the way, that we do have here, that was released in 2022, sort of showing us exactly where we are. It was released by the Ministry of Health. And they said the first challenge that they identified as to why cancer is still the #2 killer within the country is awareness, screening. I want to start with KNH as well. Have you made it easier that today I would wake up from my house, go to KNH and ask for a screening? That is something that we never used to see in the country just some years ago. Could you tell us exactly how you made this process easier? So that anybody who's listening to today will say, well, we don't have a cancer center at KNH. Good. But can I wake up today with my card and say, can I get a cancer screening? What is the process and what advancements has KNH made in this area?
So as a hospital, we are screening patients almost on daily basis. We have various clinics running. We have medical clinics, surgical clinics. We also have a 24-hour accident and emergency unit. Having said that, Kenyatta is a level 6 hospital, which means is more specialized. And patients, most of the time when they come, it's on a referral basis.
On a referral basis.
Yeah, but if it's an emergency or you have a scheduled booking, because screening, you can come in and book. It is possible, it can be done. For women, we know that cervical cancer is very common. We have Clinic 66 where a woman can walk in and get screened for cervical cancer. For breast, which is also one of the commonest cancers, we have the breast clinic that runs. So a patient can report, say, to the casualty and then will be directed to the breast clinic. For the men, prostate cancer is leading, so we have the urology clinic. You can walk in, be booked in the urology clinic. If it's throat cancer, also very common, we have the ENT, ear, nose and throat clinic. So all those clinics are running every day, and on specific days they do different things. We are able to do, if they suspect you have cancer, we have equipment in Kenyatta we can do biopsy. We have pathology lab, they can look at the sample, and we have treatment available. So because we know that we have other supporting hospitals to Kenyatta, not everyone can wake up and go to Kenyatta. We have county hospitals also available. So some things can be done there. Like you can walk into your county hospital and get checkup, and if they think you need a referral to Kenyatta, you can still be referred. And as a hospital also, we do carry out awareness camps or sessions. So if there's maybe it's a cervical cancer awareness day, we go out to the community and create awareness and even screen. Like case in point, February last month, we were in Kasarani in partnership with the National Cancer Institute and other stakeholders, both public, private, and even the members of the public and children. We were sensitizing on screening, we were screening people, we were even immunizing young girls against human papilloma virus.
Yes.
So we actually ready to support the community. You can walk into Kenyatta, you can walk to the nearest health facility, and you can also join the camps that we always do. And whenever there's a camp, always there will be sensitization or awareness through the media so that people can know we can go here and be screened.
Cost has been an issue. And every time you tell somebody that, well, we're going to treat cancer as a family, the report identified that cancer treatment has crippled the financial status of majority of the families in the country, which puts KNH on the spot in the sense of if it's been identified as the best cancer center in the country, then cost has to be another area that they really got to look into. Now, let me give you an example. Majority of Kenyans, and these are stories that are synonymous online, that Dr. Catherine is, a majority of Kenyans would rather get cancer treatment outside the country. Case in point, India has been synonymous with treating Kenyans who've been affected by cancer. How is KNH handling this particular issue, cost of treatment?
So we did, actually through what is called this patient navigation program, we collect data,
yes,
and we analyze data, and we've realized that over 90% of the patients actually have an active National Hospital Insurance Fund card. And this has gone a long way in reducing the cost of care. And being a public institution, a patient can get surgery using the NHIF card. You can get chemotherapy using the card. You can get radiotherapy using the same card. It is not a comprehensive cover, but it has reduced the financial burden for most of the patients. And for those who can totally not afford, we have a system, a credit system that is in place through the medical social worker. They'll come, assess the client, and if they cannot afford the treatment, the hospital is able to offer care on credit to that patient.
Yes.
And they will not be turned away or denied any treatment. In fact, most of the patients coming to us in Kenyatta are unemployed. Over 70% don't have a formal employment. So you see the financial burden is very high. They're unemployed. But we encourage them to enroll on the NHIF. We have even well-wishers who come in. Somebody can say, I'll just volunteer and pay 12,000 for this patient for them to have an NHIF card. So we encourage people out there, if you want to support a cancer patient, you want to make change in their life, just go to the cancer center, identify through the patient navigation or medical social worker, you can identify very poor patients, and you're able just to pay for them their card. You don't have to give them money, but pay for an NHIF. And this will go a long way in making their cancer journey more easier. Yeah.
Pretty much. I want to take a tiny break there. But once we come back then, this issue of how advanced then are we as a hospital, at our cancer center, the Kenyatta National Hospital then, to the point that we will start to say goodbye to these stories of people traveling out of the country to seek cancer treatment. At what level are we talking about? As a department of cancer, KNH, do we have international standards when it comes to treatment of cancer within the country? The conversation goes on about looking at cancer and the fight that Kenya is having against cancer. It is a national dialogue. You can't avoid it. And every time you talk about cancer, then you gotta look at the numbers. We were talking about a mortality rate of about 27,000 in a year, then you're way up there among the top killers, which is no journey at all, because indeed cancer is the second killer in the country. Think about that. Once we come back then, we'll be looking at exactly how we as Kenya, and when I talk about we as Kenya, we are referring to the cancer center at the Kenyatta National Hospital. How advanced are we in handling cancer patients in the country? Case in point, We've seen a lot of stories of patients who leave the country to go seek for medical care elsewhere other than right here in the country. Be part of the conversation. Lookuptv across all your social media platforms. I am at Kiage Simba. By the way, talk to us. We'll be putting those questions to Dr. Catherine right here. Once we come back, the conversation continues.